Infradian rhythms are rhythms that last longer than 24 hours. A common example of this is the menstrual cycle, which is the monthly changes in hormone levels which regulate ovulation. Other examples include the hibernation of animals during the winter season, as well as a human example of SAD, which is known as seasonal affective disorder. So let's take a look at the menstrual cycle. The menstrual cycle is a cycle that lasts about 1 month, so therefore an infradian rhythm. Like other rhythms, the menstrual cycle appears to be under the influence of both internal mechanisms, known as endogenous control, as well as external Zeitgebers. The endogenous control of the menstrual cycle is that the cycle is under the internal control of hormones, particularly estrogen and progesterone, secreted by the ovaries. These cause a number of physiological changes within the body, including the release of one egg from the ovary and the thickening of the lining of the womb, also known as the uterus, in preparation for the arrival of the egg. If the egg is not fertilized, then the lining of the womb is shed and menstruation occurs. On the other hand, it seems to be that the menstrual cycle might also occur due to the influence of Zeitgebers, which are your external control. It has long been known that the menstrual cycle can be influenced by external factors, most notably by living with other women when women's menstrual cycles synchronize. The most likely mechanism for this is by the action of pheromones. These are chemical substances similar to hormones, but which carry messages between individuals of the same species. Support of the influence of Zeitgebers on the menstrual cycle was done by Martha McClintock and her armpit pheromones. So Martha McClintock in 1971 was the first to notice possible synchronization of menstrual cycles amongst women living in close proximity. In 1988, McClintock and Stern published their findings of a 10-year longitudinal study into external control of the menstrual cycle. They had followed 29 women aged 20 to 35 who had a history of irregular menstrual cycles. Sweat samples from the armpits of 9 of the women had been collected, sterilized, and dabbed onto the upper lip of the other 20. Their findings were that, on 68% of occasions, the recipients of the sweat donation had responded to the pheromones. Armpit compounds collected from the 9 donors in the later phase of the menstrual cycle shortened the cycles of the 20 recipients. Conversely, when the 9 donors were in the early phase, the compounds lengthened the cycles of the same 20 recipients. Therefore, in conclusion, they found that the study shows that menstrual cycle of a woman can be altered by communication via pheromones.
The effects of pheromones can help to explain menstrual synchronicity in situations where women live together, such as at university or in nunneries. The communication via pheromones explains it as there must be something in the shared environment that acts as a Zeitgeber. Although how closely women live together and for what length of time for synchronicity to occur is not clear and still requires further research. Bentley talked about the evolutionary advantages of external control of the menstrual cycle. He believed that synchronization between women living in close proximity would ensure that women would conceive and give birth at similar times. This would be beneficial since they could share breastfeeding, a behavior observed in other species too. Similarly, McClintock found that women who work in mostly male environment have shorter menstrual cycles. In the past, this would have been an evolutionary advantage since it would provide more opportunities for pregnancy. Wilson challenged the idea of menstrual synchronicity, stating that experimental evidence of its existence was exaggerated. Also, the validity of the evolutionary perspective has been questioned. If there were too many females in synchrony, this would produce competition for the highest quality males, which would lower the fitness of potential offspring. Therefore, avoiding synchrony would be a more adaptive evolutionary strategy.
Another example of an infradian rhythm would be the seasonal affective disorder, which is also known as SAD. Although it is apparently normal for most people to feel more cheerful in summer months than in winter, a small number of people suffer an extreme form of this that appears to be related to the lack of bright light in the winter months. Light levels are detected by receptors in the eye and influence levels of melatonin and serotonin, which is implicated in mood. At night, low light levels stimulate the production of melatonin. This is what triggers sleepiness. Therefore, you would expect the low light levels of the winter months to have a similar effect. In areas where light levels are exceptionally low for prolonged periods, such as polar regions, you would expect the effects to be particularly noticeable. This was found by Terman in 1988, who found that seasonal affective disorder was 5 times more common in New Hampshire, a northern state of the US, than in Florida.
SAD has very similar symptoms to depression, but these symptoms only usually are prominent during the winter months and in some cases during the summer months. The symptoms of SAD compared to depression are very similar. You tend to have a low mood, lack of interest and enjoyment in life. You tend to be less sociable, less irritable, and you tend to have quite a low energy in general. Some of the symptoms that are usually specific to SAD are you tend to sleep more and eat more.
29% of British adults experience symptoms of the condition during the winter months. Of these 29%, 8% suffer from acute symptoms, whilst the remaining 21% suffer from milder forms. Whilst only 29% suffer from actual symptoms, 57% of adults say their overall mood is worse during winter. Moreover, women are 40 times more likely than men to experience symptoms. However, there are treatments for this disorder. Possible treatments include cognitive behavioral therapy, antidepressants such as selective serotonin reuptake inhibitors, light therapy, and regular exercise.
The way light therapy would work is you have a box with a lot of bulbs in it. It's very bright. And what you do is you look into the box, and because it's so bright, it simulates a bright summer's day, which is supposed to up your mood.
Symptoms of SAD can be reduced in polar regions by sitting patients in front of a very bright artificial light for at least an hour per day. This lowers the levels of melatonin in the bloodstream, which in turn reduces the feelings of depression. The precise mechanism for this is still unclear though. It could be that melatonin, released from the pineal glands, has a direct effect on mood, or it could have influence indirectly through serotonin. Drugs used to treat depression, such as Prozac and MAOI, appear to work by alternating serotonin levels. Terman researched 124 participants for SAD. 85 were given 30-minute exposure to bright light, some in the morning and some in the evening. Another 39 were exposed to negative ions. They were the placebo group. 60% of the bright light group showed significant improvement compared to only 30% of those getting light in the evening. Only 5% of the placebo group showed improvements. The researchers concluded that bright light administered in this way may be acting as a Z-GABA and resetting the body clock in the morning. Research into SAD has led to effective treatments, suggesting that the theory has some validity.